Everyone, welcome to our channel. I am Ashish. In this video, I will teach you about the femoral triangle. So, what is femoral triangle? It is a triangular muscular depression. Where it is located? It is located on the front of the upper one third of thigh below the inguinal ligament. So, if you see in the diagram, you can see the front of the thigh, and it is a muscular depression. Means due to the alignment of different muscles, there is some gap or depression present, which is called the femoral triangle, and it's very important clinically that we'll be able to understand by the end of this video. So in the introduction part, you must write in your answer that what is femoral triangle. So how you define it? So it is a triangular depression which is located on the front of upper one third of the thigh below the inguinal ligament. So you can see in this diagram, it is located in the front of the upper one third of thigh. You divide the whole thigh into three parts: upper one third, middle one third, and the lower one third. Why we are dividing into three parts? Because there are three structures that were very important, and there are some particular features of the junctions of the upper two third and the lower one third that all we'll study in the lower limb anatomy. So meanwhile, you should know we divide the thigh into three parts. So in the upper one third and on the front side of the thigh below the inguinal ligament, there is a triangular muscular depression is present, which is called the femoral triangle. So as it is a triangle, we will have an apex. So it will have an apex, the pointed part. We have a broad base, and will have its boundaries. So we'll have lateral boundaries and medial boundaries. Apart from that, we have two more structures: roof and the floor. So these are very common things that we discuss when you're discussing any triangle of the body. It may be the anterior triangle, posterior triangle of the neck. All these things we have to write. That's apex, base, its boundaries, floor, and roof. Now we'll talk about the muscles first, then we'll see which muscles are forming the which part of the boundary. Now we have total 5 muscles in the femoral triangle, so you should remember that are this inclined muscle over here. This is called the Sartorius. Then we have the iliacus. Then we have the tendon of Soyuz major, Pectineus, and the adductor longus muscle. Adductor longus is a name suggests it helps in the adduction of the leg. Okay, suppose this is the midline axis of the body and this is the axis of the leg. So it helps in adduction or keeping the leg together towards the midline. So we have three adductors: longus, brevis, and magnus. So among the three we have the longus over here. Okay, so in total we had the 5 muscles that you should remember in the femoral triangle. So the 5 muscles are the first one, the Sartorius, the inclined muscle. Then we have the iliacus, tendon of Soyuz major. Some of the examiners are quite particular about the tendon. So the boundary or the involved in the femoral triangle is the tendon of Soyuz major and not the belly. A muscle has different parts: belly, tendon, or it may have some modified part. So here the involved structure is the tendon of the Soyuz major. So for the Sartorius, iliacus, tendon of Soyuz major, Pectineus. Then in the last we had the adductor longus. Before moving into the detail of the femoral triangle, let's study about the muscles of the triangles first. So this muscle over here that you can see in the front of the thigh is called the Sartorius. Sartorius originates from the anterior superior iliac spine of the hip bone and is inserted into the medial surface of the superior shaft of the tibia via the tendon of the pes anserinus. So this was the first muscle that you should know, that is the Sartorius. It forms a lateral boundary. It is the action of one of the action of the Sartorius that you can see over here. Flexion. This is one of the action of Sartorius. Next muscle over here in the medial part is the Pectineus. Pectineus originates in the pectineal line inserted to the posterior surface of femur on a rough line leading to the lesser trochanter or to the linea aspera. So you can see the lesser trochanter in the model as well. Next muscle is the iliacus. You can see the iliacus originates from the pelvic region and extends down to the near the neck of the femur. So this is the Soyuz major muscle. It is a very long muscle that originates from the transverse column of different vertebral column that we will study in detail when we are discussing about the posterior surface of the abdomen. Now this is the next muscle that is called the adductor longus. It originates from the front of the pubis and inserted into the linea aspera between the vastus medialis and the adductor magnus. We have three adductors: adductor longus, brevis, and magnus. And this is a complete triangle, and you can see the depression over there. Due to the different alignment of the muscle, a depression form which have the different contents of the femoral triangle. Some of the contents are the femoral artery and the femoral vein that you can see that run along the depression of the femoral triangle. So it's nothing but a triangular depression form. Now we'll trace out triangle. So its medial border is formed by the its lateral border is formed by the medial border of the Sartorius, medial border is formed by the medial border of the Adductor Longus, and the base is formed by the below surface of the inguinal ligament. And apex we will study in detail. So this is just an orientation to the approach of the femoral triangle. I will request you to draw the triangle along with me to having better understanding of the femoral triangle and its boundaries. So in this diagram you can see we can make out many triangles. Like one triangle can form like this, another triangle can form like this, one another we can have like this. Okay, so what triangle is actually the forming the boundaries of the femoral triangle? So we have to trace out like this. So this is forming the base. You can see the inguinal ligament is forming the base. Now we have to trace along the medial border of the Sartorius. As Sartorius is a long muscle, it will have some borders. So this is the lateral border because this is the lateral side and this is the medial side. Here is the ASIS, anterosuperior iliac spine, and this we have the pubic symphysis. So this is the lateral side and this is the medial side. So this will be the lateral border and this will be the medial border of the Sartorius. So you have to trace along the medial border of Sartorius, and then we have another long muscle over here, and you can see another broad muscle over here, that's the Adductor Longus. It will similarly have the lateral boundary and a medial boundary. So it runs along the medial border of Sartorius. So the triangle concerned over here, that's the femoral triangle, is formed like this. So in the base we have the inguinal ligament. Lateral border is formed by the lateral boundary is formed by the medial border of the Sartorius. Now you can understand why it is necessary to mention the medial border, because Sartorius is a broad muscle and Adductor Longus is also a broad muscle, and we can have a different regions over here. So you have to particularly concern about the which border the triangle runs along. Okay, so it runs along the medial border of the Sartorius, and it's quite easy to remember. Medial boundary is also formed by the medial border of the Adductor Longus. Now the apex, as you can see, it is formed by the meeting point of the medial border of the Adductor Longus and the Sartorius. The Sartorius medial border and Adductor Longus medial border meet at a point which is forming the apex of the femoral triangle. Base, as you can see in this diagram, it is formed by the inguinal ligament. Now some commonly usually referred mnemonic for the boundaries, that is SAIL, SAIL, for the different boundaries. Okay, so lateral boundary will have the S, that's the medial border of Sartorius. Medial boundary will be formed by the A, that is the Adductor Longus, and IL stands for inguinal ligament, which is forming the base. I usually don't refer to this mnemonic because it does not give the whole idea of the boundaries. That's why I usually try out to figure out the boundaries with the diagram. Okay, now for understanding the flow, let's look at this. Suppose this is the, as I told you, it is a muscular depression formed by the different alignment of the muscles of the femoral region or the front of the thigh. So these are the one group of muscles lying on the just above the bone, that's the femur. We have one muscle inclined placed over all these four. Okay, so this is the Sartorius. So this is the Sartorius. Okay, so you can see, if you look from the side, you can see depression is formed where I have put my finger. So in this depression we have the contents of the femoral triangle, and this is the femoral triangle. Okay, so the floor is, you can see, is formed by these four muscles. As it is a muscular depression, the muscle itself is forming the floor. So the four muscles are the iliacus, tendon of Soyuz major, we have the Pectineus here, and the Adductor Longus. So you can note the notable point is that Adductor Longus is forming the floor as well as the medial border of the femoral triangle. So this is a notable point over here. You can make a star or hashtag over here. Okay, so this is very important to note. Adductor Longus is forming the floor as well as the medial border of the femoral triangle. So in the floor we have the floor is muscular and it's gutter shaped because it has a depression, as I tried to explain you, from lateral to medial side. So this is from lateral to medial side. We have iliacus, tendon of Soyuz major, Pectineus, and the Adductor Longus. Now look at the roof. So this is, we are looking from the front side. If we make a cross section over here and look from the above, it will appear something like this. Okay, so this is the lateral side, this is the medial side, and this is the anterior, and here is the posterior. So this is the anterior side and this is the posterior side over here, posterior side. This is lateral and this is medial. Lateral and medial. So anteriorly will have the skin, then we will have the superficial fascia, then we will have the deep fascia, then we will have the contents of the femoral triangle along with the muscles. Okay, as I told you, it is a muscular depression. So in this depression, as I tried to explain with the help of this sketch pens, so in this depression, this layer depression will have the contents of the femoral triangle that will be running, that we'll see in the next section. Okay, so this is the contents of the femoral triangle, and here we have the group of muscle. And so posterior boundary is also formed. Posteriorly we have the, just below the muscle, we have the head of the femur as well as the capsule of the hip joint. Okay, so you should make your diagram something like this. Now let's concentrate here. So we'll having the anteriorly we have the skin. So the roof is formed by the skin. Another thing is that it is formed by the superficial fascia, but superficial fascia has some contents that are the branches of the femoral artery. We have the accompanying veins which accompany the femoral artery, upper part of the great saphenous vein, superficial inguinal lymph nodes, and we have two nerves, FGF and BIN. FGF stands for femoral branch of genitofemoral. So if you study about the different plexus of the lower limb, in that I have mentioned that femoral genitofemoral nerve. Okay, so we have the femoral branch of genitofemoral nerve over here. Okay, so the contents are the femoral artery, femoral vein, we have superficial inguinal lymph nodes, as well as the one nerve, that is the femoral branch of genitofemoral. Along with that we have one more nerve, that's called the BIN. So BIN stands for branches of the ilioinguinal nerve. So these contents you must remember what are present in the superficial fascia. What about the deep fascia? It is formed by the fascia lata, and this is the plate-like structure where the sieve-like structure, which is called the cribriform fascia. So this is the fascia lata, which over the femoral vein forming the cribriform fascia. So cribriform fascia has a opening which is called the saphenous opening. So if you look at this diagram, you can see the saphenous opening. Saphenous vein is a vein which carries all the superficial deoxygenated blood from the toe till the saphenous opening and open in the femoral vein. Okay, so this you must remember in the roof. So like this we have completed the boundaries. Now let's see about the contents. The contents are quite easy to remember. You can see in the word femoral we have 7 alphabets, 1 2 3 4 5 6 and 7. So we have 7 contents. So in total we have 7 contents, and they are very easy to remember. See, vein, artery and nerve, that's vein, and all this will be the femoral. So we have femoral artery, femoral vein, femoral nerve, and deep inguinal lymph nodes. So deep inguinal lymph nodes is forming the contents of the femoral triangle. And what about the superficial inguinal lymph node? Superficial inguinal lymph nodes are present in the roof, that's in the superficial fascia. Then we have two nerves, that are the lateral cutaneous nerve of thigh and femoral branch of the genitofemoral nerve. Always remember, FGF runs along with the femoral artery. This is a key point to remember. I request you to watch the 3 videos, that are the first one is the femoral triangle, then femoral sheath and femoral canal in succession, to have a good overview of this upper front of the thigh, that's especially in the upper 1/3 part. Okay, so we have 7 contents. Now let's understand this contents with the help of this diagram. So you can see the ASIS. ASIS stands for anterior superior iliac spine, and here we have the pubic symphysis. So from here originates the Sartorius. So this is the Sartorius, where the medial border is forming the lateral boundary, and the medial border of adductor longus is forming the medial border is forming the lateral boundary, and adductor longus is forming the medial boundary of the femoral triangle. So what all contents you can see? First of all, we have the femoral artery, then we have the femoral vein, then we have the femoral nerve and some branches. See, here we have the lateral cutaneous nerve of thigh, which is forming one of the contents of the femoral triangle, and we have the deep inguinal lymph nodes. Along with that we have some fibrofatty tissue over here, because it's depression and we have to fill the remaining gap. So there is some fibrofatty tissue present. But there is some notable point over here. As you can see this diagram, suppose this is the femoral vein. The femoral artery is present laterally in the upper part, but it's present anteriorly to the vein in the lower part. So the artery runs something like this. Okay, so you can see the vein is running straight downwards, but the artery is lateral to the femoral vein in the upper part, and it is present anterior to the vein in the lower part. Now, what are the clinical importance of this femoral triangle? Because it's very important topic, so you must know the clinical point. That is, they are used for the catheterization of the femoral artery. Then we have the its most easier vascular access that can made in the lower limb is through the femoral triangle. Femoral artery is also used for measuring the femoral pulse. In case of the radial pulse or the carotid pulse is not easily feasible. Okay, now one more important point here, we have the femoral hernia. Femoral hernia is usually common in this region because at the back we have some weak structures which make this region prone to the femoral hernia. Okay, so you must remember one more point. The upper part of this femoral vessels are accompanied or covered by the facial sheath, that's called the femoral sheath, that we study in the next video. If you like the video, please hit the like button and do subscribe to our channel. Thanks for watching.